In this episode, we are going to learn about 10 nursing procedures you must know before your first clinical rotation. These are simple things and these are procedures that you must know before your first clinicals. I know this might be the first time you are going for clinicals and you've not encountered the real world at the hospital. Maybe you're in the hospital, so you might be wondering, what am I going to do? What am I going to say any other day? And you see the hospital also a place is different from the books that you are learning in school and different from your school's practical room. So you must know these 10 procedures before your first clinicals. The first procedure that we are going to talk about is hand hygiene. Hand hygiene is one of the most important things you must know before your first nursing clinicals. And very, very, very important. Before you enter the hospital, or the first time you enter into the hospital, wash your hands. Before you touch anything at the hospital, wash your hands. Before you touch any patient, wash your hands. After you are done going to touch, or after you are done touching the patient, or doing whatever you are supposed to do for the patient, please wash your hands. And make sure that if you touch this patient, you will wash your hands before you go and touch the other patient. Hand washing is one of the most important things you must know before your first clinicals. Then, the next one that you are going to also know, or you should know before your first clinicals, is how to check vital signs. Mostly students, the only vital signs is checking recorded. Please, you need to know how to check vital signs. You need to know all the normal ranges before your first clinicals. You need to know the normal range for BP. You need to know the normal range for oxygen saturation. You need to know the normal range for the respiration. And maybe you might find yourself at the ICU, or you might find yourself at the NICU. You see, that place, more respiration is different from maybe you being at the adult. So you need to know the normal ranges and everything before you go to your first clinicals. Important. This is the second procedure.